level, but also at medical level in conversations with the Republic, with the decisions that they take. But we have very intensive discussions within the UK about the timing of changes within the country. Thanks very much. Steve Ford from the Nursing Times.
Good afternoon. A Nursing Times survey has indicated almost all nursing staff are feeling more stressed and anxious than usual, and a third described the state of their mental health as bad during the COVID-19 crisis for reasons including PPE shortages. So my question is, what are you going to do in the long term to protect the mental health of nurses and other staff on top of the helplines that have already been announced, as we already have a well-documented nurse shortage, and I hope you'd agree that we can't afford to lose any more in the coming months. And secondly, what's your message for Black and minority ethnic staff who feel they may have been put at greater risk given the emerging evidence from the mortality data?
Thank you very much, Steve. I think that the way that nurses across the NHS have risen to this challenge has been admirable. The bravery and the flexibility that nurses have shown right across the NHS. I think that's something that the whole country recognises it, and I recognise it as Health Secretary. I think that certainly the measures that we have put in place to help people with the stress and more serious mental ill health as a result of work, those measures are important, and I'm very glad that they're in place. I've been trying to get them in place for some time, and we managed to put them in place very quickly as the crisis began. But the other thing, it's undoubtedly true when you talk to nurses on the front line, that increasing the number of nurses so that there are more to do the work that's needed is a really important part of the plan. And as you know, we committed in the election to 50,000 more nurses by the end of the Parliament. We remain committed to that. In fact, we've seen more nurses come into the NHS over the autumn, and then also as a result, direct result of the appeal for nurses who'd left the profession to come back. So we have got more nurses back into the NHS, and I want to support and cherish every single nurse who works in the NHS because of the important work that they do. And so I'm sure that'll be a big conversation as we restore the NHS, and thank everybody for the work that they've done during the difficulties of coronavirus. Steve, I don't know if you want to add anything.
No, I think your point again is a very good point. And of course, it's not just nurses, as you pointed out yourself. It's all staff. There's been a tremendous effort by staff across the NHS. They have been working incredibly hard, sometimes in different areas from where they usually work, and of course that brings its own stresses. And I know, talking to the chief execs and the medical directors, chief executives and medical directors of many of our hospital trusts across the country, that as we begin to now stand up some of the services that we have had to stand down to manage this surge in coronavirus patients, those leaders locally are thinking very hard about how they support staff, because they absolutely recognise that they have gone through a very challenging and at times very stressful number of weeks, and that support is required both in the short term and over a longer period of time to ensure, as we move back towards a normal, won't be completely back to normal while we still have COVID, but back towards normal, that staff have the support they need. So I think the comments you've made are very much reflected in the comments I hear from our leaders across the health system.
Maybe you could answer Steve's second question as well.
Sorry, the second question, just remind me, the second question was, Steve?
Black and minority. Right, yes. Oh, what's your message for Black and minority ethnic staff?
And John might want to answer some of this as well. So I think the message for Black and minority staff is that we absolutely recognise, as